Hi there, I'm Dr. Shauna DeRue. I'm a naturopathic doctor with a clinical practice in downtown Toronto. I've been seeing women in my practice for over 14 years now, and a big focus of my practice is on hormones. So the start of this series is a broadcast called "Do You Have a Hormone Imbalance?" Because this is a question that comes up in my practice all the time, and I wanted to go through some of the signs that you might have a hormone imbalance and what they could mean. Because your body is just sending us signals, and if we can interpret what those signals are, we can understand better what's going on, and then we can take it further with some testing. So sometimes a hormone imbalance is really obvious. So if you are a woman, below the age of 50 or before menopause, a hormone imbalance could look really obvious, like getting irregular periods or absent periods or periods that are coming too close together or lasting too long. So sometimes it's really obvious. It may also look like acne troubles or extra hair growth on your face or body hair. It could look like a lot of spotting through your cycle or terrible PMS or hair thinning. And the other thing to note is that your hormones all work together, so they're all integrated. So if we're looking at your menstrual cycle and how those hormones work, it's influenced by your thyroid hormones, it's influenced by your stress hormones, it's influenced by your blood sugar regulation. So all of these factors come into play, and those external factors around stress, blood sugar, and thyroid tend to amplify an underlying hormone imbalance. So in another talk, I'll go through some theories as to how and why hormone imbalances develop, but let's just talk about some of the signs and symptoms right now. So one of the most obvious ones is what's called androgen excess. So that could be an excess of either testosterone production in a female body, or it could be other androgens coming from your adrenal glands, which are your stress organs. So that would be an excess of DHEA or androstenedione. So in this case, we would look at we would see signs like acne. And acne with androgen excess tends to be more cystic and especially located on the lower face and jawline and on the neck as well. There's often some body acne as well, but the lower face with cystic acne is often a sign of androgen excess. Other signs could be thinning of the head hair, so especially on the crown. It could be excess of facial hair that's not, culturally normal for you. So, especially like upper lip and under the chin and, sideburns, that type of thing. And then it can also be extra body hair. And again, that depends on your family and where you're from. Some, in some cultures, there is naturally more body hair growth in women. That has nothing to do with hormone imbalance. But thickened body hair on the arms and the legs, and hair growth below the belly button, hair around the nipples would be some signs of high androgens. High androgens can develop, for various reasons. The most common cause is a hormone imbalance called polycystic ovarian syndrome, or PCOS, but there's other causes as well. There's the mimicker of PCOS, which is called NCAH, or non-classic congenital adrenal hyperplasia. Some women naturally have high DHEA and adrenal androgen levels, in which case their hormone imbalance symptoms would get exaggerated with stress. And I will go through each of these conditions individually in separate talks. So that's number one, androgen excess, which in some cases will be also come with irregular periods, and in some cases the periods may come very regularly, but we just have those signs as well. Another really common hormone imbalance is progesterone deficiency. So progesterone is a hormone produced by your ovaries after ovulation, and it tends to be, in a good, healthy, strong range for most young women, and in almost all cases it starts to decline over the age of 35. So what we end up with low progesterone would be significant PMS symptoms. So lasting more than 3 days, interfering with your day-to-day life, having more mood swings and breast tenderness and bloating, fatigue, that type of thing, irritability, having difficulty with your relationships in the week before your period. Another sign of low progesterone can be cyclical headaches. It could be insomnia in the week before your period. It can be anxiety in the week before your period, or premenstrual spotting is another one. Recurrent early miscarriage sometimes happens also with low progesterone. So progesterone is actually quite easy to test for. So we would not diagnose a low progesterone without testing first, but those are some of the symptoms that could be related. To test progesterone levels, it's simply a blood test that's done in the second half of your menstrual cycle. So if your periods come every 28 days, we would ideally test on day 21 or so. If you have a longer cycle, like a 31-day cycle, we would test a few days later, day 24. It's important to test it at the right time, otherwise you might get a falsely low number. Testing your progesterone early in the cycle doesn't work because your body is not producing it yet. So that's low progesterone. The next category would be estrogen excess. And estrogen excess can come from a couple of scenarios. Number one, it can come from a relative estrogen excess when progesterone levels are low. So we'll get some of the estrogen symptoms then. It can also come if the ovaries are overproducing estrogen, which is really common in perimenopause. We call it the estrogen storm, where levels are actually higher than just post-puberty even. So it creates a lot of hormonal symptoms in that range as well. And in other cases, the estrogen excess can come from having difficulty detoxing and breaking down estrogen. So some people have genetically inherited some slow detox pathways, which can create higher estrogen symptoms. It would also be exaggerated if you are overweight, especially carrying excess abdominal weight. Because your fat cells produce a form of estrogen called estrone, which contributes to your estrogen load. And then we've got the environmental factors as well, all of the xenoestrogens or the estrogen mimicking chemicals, which will exaggerate your estrogen symptoms as well. So signs of high estrogen can be puffiness and bloating, breast tenderness is a biggie, carrying weight around the upper thighs and the buttocks and the lower abdomen, really heavy menstrual flow, that's probably the biggest one. So the uterine lining gets thicker with high estrogen, and that creates heavier, more dramatic periods. High estrogen can contribute to cervical dysplasia, which means abnormal cells on the cervix, abnormal pap tests. It can contribute to gallbladder problems and can definitely lead to some mood swings. But the heavy periods are the number one sign of high estrogen levels. The next is the exact opposite, which would be low estrogen. And low estrogen is most common at menopause, but there are other scenarios where women express low estrogen as well, especially if they have low body fat, are very athletic. Then their estrogen levels will drop along with the body fat, and sometimes their periods may stop. But around menopause, the low estrogen is a big part of what contributes to things like night sweats and vaginal dryness. Sometimes there's a lethargic depression, hot flashes, can increase the rates of bladder infections, and sometimes is associated with changes in memory as well. So low estrogen, we would associate with some of the menopausal symptoms as well. The next one is estrogen dominance, which I hinted at a little bit before. So this is a combination of low progesterone with symptoms of high estrogen. So in this case, the estrogen may not actually be elevated, but there's a relative increase in it. So meaning you're expressing more estrogen symptoms because the progesterone is low. That scenario can contribute to the development and the worsening of things like uterine fibroids, endometriosis, fibrocystic breast disease. It can contribute to the growth of, not the development, but the growth of breast cancer and endometrial cancer and things like that. So it's really important that we work on these hormone issues because they can contribute to some pretty significant and annoying symptoms. So stay tuned in some of the upcoming broadcasts here. I will be going through each of these scenarios. We'll be talking about polycystic ovarian syndrome. We'll be talking about androgen excess, hair loss, endometriosis, fibroids, all sorts of things, so that I can go through with some useful tips. I would love to hear any questions. Please leave them in the comments below. And I've left info about how to contact me in the links below. And please subscribe. This is going to be a really active channel in the upcoming weeks. Thank you and have a wonderful day.